Tēnā koutou, tēnā koutou, tēnā tātou katoa. Tēnei te mihi atu ki a koutou katoa huri noa I te ao. Tēnei te mihi atu ki ngā iwi takitaki huri noa I te ao. Tēnā koutou, tēnā tātou. E mihi anō nei ki tā mātou hāpori hauora huri noa I te ao. Tēnā koutou. Tēnei te mihi I te ata, I te ahiahi, I te pō rānei. Kia ora and welcome everybody. It is wonderful to be here to open this 6th edition of Global Public Health Week for the World Federation of Public Health Associations. The theme this year is Peace for Health, Health for Peace. This week invites us to reflect on the deep and inseparable connection between peace, equity and public health, especially in a world facing conflict, climate change and widening inequities. This year, Global Public Health Week is truly global in every sense. We are hosting over 100 events across approximately 73 countries, delivered in 21 languages, including English, French, Spanish, Arabic, Chinese, Swahili, and many more, spanning 12 different event types, from webinars, workshops, to campaigns, trainings, and in-person gatherings. This diversity reflects the strength and unity of our global health community. Throughout this week, we will explore how public health can strengthen peaceful societies, protect health systems in times of crisis, advance prevention, address climate change and environmental challenges, and support healing and recovery. My name is Emma Waimaria Rawson-Te Patu. I am the President of the World Federation of Public Health Associations, and very proudly the first Indigenous woman to hold this role. This week is significantly important to me as an Indigenous person, Indigenous leader, and newly expert member of the United Nations Permanent Forum. At the outset, I would like to extend my sincere thanks to two extraordinary women leaders who are joining us today. Ms. Monica Kosinska, the World Health Organization Global Lead on Health Equity and Social Determinants, and Ms. Kelly Haynes-Mendez, Senior Director for Human Rights at the American Psychological Association. Thank you both very much for your contributions to this opening ceremony today. Your leadership, courage and unwavering commitment to justice, equity and health continue to help us shape a future for public health in profound ways. We're deeply honoured to have you both join us today. As President of the World Federation of Public Health Associations, my key priorities are grounded in simple but urgent truth. Health must be equitable, inclusive, and rooted in human dignity. First, we must place health equity at the centre of all policies, not as an afterthought, but as a guiding principle. Second, we must strengthen public health systems so they are resilient, community-led, and prepared for the challenges of our time, from pandemics to climate change and war. Third, we must embed human rights into public health practice, ensuring that every individual everywhere can access the conditions necessary for health and well-being. And finally, we must invest in partnerships and solidarity, because no country, no community, and no sector can do this work alone. This is significantly pivotal for us in the world today in terms of how we are moving and behaving as a public health community and practitioners from a very central being of humanity and our ethic and moral obligation to do right by the person next to us. My aspiration for our shared future is bold but necessary. A world where health is not determined by geography, income, or identity. A world where peace, justice, and well-being are not separate goals, but interconnected realities. A world where public health is recognised not only as a technical field, but as a moral and social movement. This brings us to the powerful theme of this week, peace for health and health for peace. So what does peace look like from a public health perspective? Peace is not merely the absence of conflict. Peace is the presence of conditions that allows people to thrive. It is access to safe housing, clean environments, education, and meaningful livelihoods. It is the ability to live without fear. fear of violence, discrimination, or neglect. From a public health perspective, peace is visible in reduced inequities, in strong and trusted institutions, and in communities where people feel seen, heard, and valued. In my experience, I have seen how fragile peace can be when health systems fail, and how powerful health can be as a bridge for rebuilding trust, dignity, and social cohesion. Public health has a unique role to play in fostering dialogue, healing divisions, and creating foundations for lasting peace. We must also recognise the critical importance of Indigenous knowledge in shaping peaceful and healthy societies. Indigenous worldviews, particularly Māori approaches to collective wellbeing, offer us profound lessons. They remind us that health is not individual, it is relational. It is about connection to land, to culture, to community, and to future generations. Concepts such as holistic well-being, collective responsibility, and intergenerational stewardship challenge us to move beyond fragmented systems and towards integrated, values-based approaches. Globally, we must elevate and respect Indigenous knowledge, not as complementary, but as essential. These perspectives can guide us in building systems that are more just, more sustainable, and more humane. This leads us to the question of leadership and accountability. What constitutes good leadership in public health? Good leadership is not only about expertise, it's about integrity, humility, and courage. It is about listening before acting. It is about centering those most affected by inequities. It is about making decisions that may not be easy, but are necessary. Accountability means more than reporting outcomes. It means being transparent, being responsive, and being willing to change course when we are not achieving equity. In our organisation, we are working to hold ourselves accountable by strengthening community engagement, amplifying diverse voices, and ensuring that our policies and advocacy are grounded in lived experience. Personally, I know that accountability begins with asking difficult questions. Who is being left behind? Whose voices are missing? And what are we willing to change to address that? As we begin this week, let us remember public health is not only about preventing disease, it is about creating the conditions for peace, dignity, and well-being for all. Thank you, and I welcome our first guest, Ms. Monica Kosinska, followed by a contribution from Ms. Kelly Haynes-Mendez. Kia ora.
Good morning, good afternoon, and good evening, and thank you very much for the invitation to be here as part of the opening of this very timely and important week. My name is Monica Kosinska, and I work with the World Health Organization here in Geneva, Switzerland, as the Global Technical Lead on Social Determinants of Health Equity. And the work that I lead at WHO includes supporting countries in advancing health equity through tackling both the living conditions that shape how people live, love, work, and play, but also the structural determinants which shape how people are able to access and exercise the power and resources that they need to live healthier lives. So WHO's work covers key determinants of health such as income, housing, education, decent work, social protection, but also the commercial environments that influence our exposure to health risks. It covers the structural determinants such as how racism, gender equality, and the economic determinants impact and intersect across this. And as WHO, we work with countries to support policy coherence across sectors as the key strategic approach to address this, including through health and health policies, which I think many of us are familiar with, but also in ensuring that public policy is protected from undue influence and conflicts of interest, supported by, for example, the WHO Framework Convention on Tobacco Control, but also other global strategies. So when thinking about how this work is anchored in our support to countries and the vision that they have for a healthier future for their populations, I think I have to say that my aspiration is for a future where we can say that health is recognized and health equity is recognized as a central measure of our societal well-being, of sustainable development, and where we can see how strong public institutions protect health equity, protect dignity, and build trust amongst their populations. Thinking about what structural changes we need to be able to achieve this, well, we all know, of course, that health equities are shaped by policy choices and by the differences that populations have in terms of access to power, money, and resources. And this is, of course, something that in WHO has been well published for the last 15 years or so, and the growing global evidence base supports. And the evidence also shows us that we need governance systems that are designed to do what we want them to do, to address these structural health inequities, and importantly, to enable more inclusive and participatory decision making. We know that for healthier communities, we need to be able to be part of the decision making that affects us. But at the global level, this means really that health and health equity considerations are integrated into the development and economic discussions, including ones on trade and on finance, and seeing that as not an add-on or separate, but actually integral to it. And at the national as well, this cannot be achieved by the Ministry of Health alone. So we need to see how to support countries in strengthening whole of government actions, multi-sectoral governance, and health and all policies, of course, is one key way that countries have chosen to do this. But it also requires strong public institutions with effective mechanisms for not only transparency, accountability, and also management of conflicts of interest, and underpinned, of course, by good data. And last but not least, it's the meaningful participation of communities in the decisions that affect them, particularly those that are affected by inequities. And that means we need to have institutions that are able to do this, to manage meaningful participation in a way that is inclusive and not extractive. And we also need to be able to meet communities where they are, so that we're not demanding that communities adapt to us, but vice versa. And the wins here go beyond the health sector. And because, and this is, of course, why we are all here today, fundamentally, health equity, inclusion, and the trust in institutions is closely linked to social cohesion and contribute to the conditions that help sustain peace. So you asked me why prevention remains under prioritized. And prevention, of course, is about creating conditions in which healthier choices are accessible, affordable, and supported by policy. And the challenge here is that the benefits are often longer term and less immediately visible, although not always. But the second challenge is that it requires sustained cross-sectoral action, and that's not easy to achieve nor to sustain. Because this sectoral action requires sectors, for example, to have the mandate to do what they need to do, to have the resources to be able to act, and to have the capacity to be able to work together towards common objectives. And developing these common objectives means redefining success in some cases for all sectors involved, to include as a goal the reduction in avoidable harm and in reduction of health inequities for all. And it also means financing upstream investments in health. And this not only includes health promotion, disease prevention, but also investments in the determinants of health and the financing of joint initiatives as well as sector-specific ones. And these are quite complex, but not impossible to achieve. And we have many good examples from across the world on countries that are doing this. And most importantly, perhaps, is that we, as the public health community, regardless of which corner of it we sit in, need to work together in order to support governance in making this happen. Because from the data point to the evidence-based decision making, all the way through to implementation, this is not something that governments, and certainly not the ministries of health, can do alone. So commercial determinants is an emerging but very important new field of public health inquiry, and it's also referred to as the commercial dimension of the social determinants of health. And it is clear, I think, or increasingly clear over the last decade or so, that businesses have a very important role to play in shaping the conditions that influence health. So, and this goes beyond what we've traditionally seen as commercial determinants or the health harming industries that are well known. Tobacco, of course, probably being the best known all of it, but and into seeing business as an actor with an opportunity to align business practices with public health goals, equity, and sustainable development. Because framing this as a determinant, as a commercial determinant, it is not an inherently negative term. It is a neutral one. It means that this is modifiable and that there is a role for commercial policies, commercial processes to be part of our decision making here. So the commercial determinants of health refer to the conditions, actions, or omissions of commercial actors that influence health. And the effects of this can be both beneficial and harmful. And we've seen many examples of sustained public health progress because of the partnerships that we have across business. And that's important not to forget in this. But the challenge for us is to ensure that the healthier choice also becomes the easiest and most attractive choice for businesses. And this is through the right mix of policy, incentive, and of course, governance is crucial here. The rules of the road for businesses need to lead them towards a healthier future and not profit at the cost of health or health equity. So the evidence shows us that socially responsible business models are certainly part of the mix here in terms of a meaningful contribution when they're aligned with the public interest, supported by clear rules, and operate within well-governed systems and the rules of the road that I mentioned earlier. Because the goal here is not only to manage risks, but really to create the environments where business success and population health outcomes are aligned and not at odds. And that is possible. And we're seeing action across countries in making this happen. Ultimately, leadership and accountability determine whether we are addressing the real drivers underpinning health and equity or not. From my perspective, good leadership here is grounded in equity, in evidence, and a clear commitment to the public interest, which is very much in line with how WHO approaches ethical and accountable leadership. And it requires the ability to act on evidence, even when decisions are complex, politically sensitive, or requiring the balancing of competing interests and not necessarily invalid interests. But it also, for me, means that we consistently feel able to ask very simple but very important questions. Who benefits from our decisions? Who are we leaving behind? And how are we allowing risks and resources to be distributed across populations? Because leadership really requires that we recognize that existing systems can unintentionally perpetuate disadvantage unless we build equity explicitly into our decisions and how we take them. And importantly, leadership is needed at all levels, not only at the top, but across institutions, sectors, and communities, because it's only through working together that we're going to be able to achieve what we want to achieve and the goals that we have set ourselves in global health today.
Good morning. Thank you. It's an honor to be a part of this conversation. I'm joining you today from the United States, and I currently serve as Senior Director of the American Psychological Association. My work sits at the intersection of public health, mental health, and human rights. I have a particular focus on equity, trauma-informed practice, and creating conditions where individuals and communities can thrive. My key priorities in population health are centered on advancing human dignity, strengthening community-based approaches to healing, and ensuring that our health systems are responsive to the lived experiences of those most impacted. My aspiration for our shared future as humanity is that we move toward a world where health is not simply the absence of illness, but the presence of safety, connection, and collective well-being, with a particular focus on equity for vulnerable and disenfranchised individuals and communities. I want to also acknowledge that we are gathered at a time of profound global instability, marked by conflict, displacement, and deepening inequities. But we're also at a point of possibility, and I want to talk a bit about the psychological scientific research around radical healing and radical joy. So throughout the time, I want to focus on three interconnected questions. So first, why human rights, public health, and mental health must be understood together. Secondly, what healing and hope look like in post-crisis settings. And then finally, turning to what leadership and accountability really require of us in the current moment. So first, it is our position and belief that human rights are the conditions that make health possible. When human rights are violated, whether through violence, discrimination, or displacement, the impact can be psychological, biological, and also collective in terms of how they impact communities. To deepen this understanding, the American Psychological Association, in its 2021 resolution on psychology and human rights, developed 5 key connections between psychology and human rights. And I want to share those 5 connections with you. First, psychologists possess human rights by virtue of being human, as well as specific rights essential to their profession and discipline. And so this is the right to mobility, the right to moving throughout the world. We've seen attacks on scholars and academic professionals. And so this particular connection is really serving to acknowledge that there are times when psychologists and psychological scientists have their rights violated. Secondly, that psychologists apply their knowledge and methods to the greater realization of human rights. And so this is around utilizing psychological science and the practice of psychology in order to further and advance human rights domestically and globally. 3, psychologists respect human rights and oppose the misuse of psychological science. And so within our own work and practices, really contributing to human rights through adhering to international guidelines and policies. 4, psychologists ensuring access to the benefits of psychological science and practice. This also includes access to mental health care and other benefits of psychological science. And then finally, psychologists advocate for human rights. So we are also responsible for and encouraged to participate in advocacy activities that are promoting and advancing human rights. And so taken together, this framework moves human rights from aspiration to action. Within psychology and behavioral science communities, using human rights language like this helps us name harm clearly. It also helps us shift power dynamics and better understand how we can incorporate human rights across the application of our activities as professionals. For instance, at APA, our robust advocacy team works in population health and health equity as examples of putting these connections into practice. We have psychologists working in state, local, and federal advocacy spaces. They are training grassroots activists and also ensuring support for policies and legislation that are in alignment with the psychological science that supports equity and justice. Next, I want to talk about post-crisis healing and moving from an individual to a more collective orientation. In post-crisis settings, we understand the importance of individual mental health support and how it is essential, but not entirely sufficient for healing. Research on radical healing, led by psychologists such as Brianna French, Della Mosley, Hector Adames, reminds us that recovery is not just about reducing symptoms, but it is also about restoring connection, community, identity, and agency. So radical healing includes the concept of critical consciousness, cultural authenticity, emotional and social support, radical hope, as well as collective action. Additionally, former APA President Tama Bryant highlights the role of culture, spirituality, and community within trauma recovery. And then finally, Bettina Love and Helen Neville are really sort of exploring the idea of radical joy and sort of reframing joy as resistance and a protective factor that can sustain resilience and connection. And so we understand from the research that healing is collective, cultural, and relational. People do not heal in isolation, they heal in relationship. And so, alongside healing, we have to talk about radical joy. And radical joy is not the absence of suffering, but a refusal to allow suffering to inform and define the entirety of our existence. Joy strengthens resilience. It can help us deepen relationships within the community, and it also helps us sustain hope. In my own work in facilitating trauma-informed dialogues on racial justice, I've seen this firsthand. When people are given the space to be heard, to be validated, and to reconnect with one another, something really shifts and people really move from isolation in sort of talking about and exploring the embodiment of these types of trauma to connecting with others and moving from despair to hope and possibility. So for public health, this could mean investing in community-based healing spaces, supporting culturally grounded approaches, and ensuring dignity is at the center of a systems level design for care. And then finally, in moments like this, leadership becomes even more consequential. I personally believe that good leadership is not only about strategy or control, it's about the conditions we create for people to thrive, even in the midst of crisis and uncertainty. My own leadership philosophy is guided by a heliotropic approach. Heliotropic leadership is the practice of intentionally orienting people and systems toward what gives life, fostering growth, connection, and human dignity, even in the face of challenges. And so I try to lead by staying rooted in joy, hope, life-giving energy, and human dignity, and really creating spaces where people feel safe to grow and bring their best selves forward. One of the examples I like to give about the heliotropic philosophy to leadership is the example of a sunflower. So if we plant a sunflower, we know that that plant will move in the direction of the sun. It will move in the direction of what gives it life and gives it energy. And so as a leader, it is my goal to provide that type of sustained life-giving energy to teams so that they can move within themselves towards growth and also growth within the team. I believe also that allowing people to stay engaged and being vulnerable makes trust possible. I think leadership also must be paired with accountability, and being accountable as a leader requires clarity, alignment, and a willingness to be uncomfortable. Within this leadership approach, I've seen teams become more resilient. I believe that people feel more ownership of the work, and the work begins to align more closely with our own personal values. So for me, leadership and accountability are intertwined and not separate. The way we lead, the energy we bring, the space we create, and the standards that we hold are all a part of being accountable as a leader. And so finally, if we bring all this together, human rights, healing, and leadership, we can begin to see a clear path forward. Peace and safety are built through daily decisions about how we treat one another. We may not solve the global crisis alone, but we can reduce harm, we can build trust, and we can create spaces for healing. Ultimately, the way we lead and the way we care for one another is itself a public health intervention. And hope, when practiced collectively, becomes an intervention for public health. Thank you.
I'd like to thank both of our contributors today, Ms. Monica Kosinska from the World Health Organization, Global Lead on Health Equity and Social Determinants, and Ms. Kelly Haynes-Mendez, Senior Director, Human Rights Team at the American Psychological Association, for their very valuable contributions. From these amazing women leaders, we heard about why we must focus on the social determinants of health, why it's important that what we do is grounded in evidence. I also think that it's important to think about what evidence do we value when thinking about which communities are heard least. We heard from Kelly around the importance between the connection to health and human rights as a necessary for public health community, and our responsibilities and our obligations to humanity. We heard about the importance and recognition that healing is collective, and the importance of understanding the need for radical hope and radical joy, particularly like some of Kelly's final words, which was peace and safety built on daily decisions about how we treat one another. Peace and safety are built on daily decisions about how we treat one another. And this is so inherently true. How am I, as a public health practitioner, being the best human I can for the person next to me? One final message from me is remember to join us in Cape Town, South Africa, for this year's World Congress on Public Health from the 6th to the 9th of September. We really look forward to having you join us. There is also still options for pre and post events to be held. If you are interested in those, please visit the Federation's website for more details around the Congress. So once again, just want to thank you all for beginning this week with us, where we will once again have over 100 events across nearly 73 countries, delivered in over 21 languages, including English, French, Spanish, Arabic, Chinese, and Swahili. And there will be over 12 different types of events held throughout this week, from webinars to workshops, campaigns, trainings, and in-person gatherings. I'd like to thank our broad public health community for all their contributions and the work that everybody puts in on a daily basis. This work is so centrally important to the success and the thriving of our population and our planet. So tēnei te mihi atu. Thank you very much, all of you, for all of the work that you do and for all of the important contributions this Global Public Health Week. Peace for health, health for peace. Tēnā koutou, tēnā koutou, tēnā tātou katoa.